Okay, we are live and ready to go.
Okay. I'd like to call the meeting to order, and just so everyone knows, our usual board clerk, Veronica, is not here. She's had a family emergency, so Dr. Lynn will be both superintendent and board clerk tonight. So thank you.
I'll do my best.
We appreciate your patience as we get through this, and our thoughts are with Veronica today. Roll call, please, Dr. Lynn.
Mr. Guziak,
Here.
Zori,
Here.
Mr. Murphy,
Here.
Mrs. Ide,
Oh, sorry, here.
Mr. Gray,
I am here.
Ms. Caspan-Latrette,
Here.
Mr. Coleman.
Here.
Okay, let's all rise for the pledge of allegiance.
Well, I get the flag going here. Sorry, take me just a second.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Denise, I believe we only have the one public comment. So could you please read that for us?
Sure. Did you want to do that now, or did you want to do that in the regular COW meeting?
Why don't we just do it now?
Okay. So we have one comment from Taryn McCandless. To all of our Millburn Board of Education and administrators, thank you for making a decision that made the safety of the students and teachers a priority. There is no safe way to return to school. Therefore, your decision to go remote is the best decision. Last week, photos from Paulding High School in Georgia went viral because of the crowded hallway. As of Saturday, there were 9 cases reported, 6 students and 3 staff. And then it has a link to a TV station. I am so happy to be part of a community that is not taking this risk. The lives of our children and teachers are far too important, and the long-term effects of COVID-19 are still so uncertain. There is no easy solution, and I know that this summer has been like no other. We all want things to go back to normal, but to put it simply, they are not. Our children would not be returning to school as they know it. The teachers would exhaust much energy trying to ensure the safety of the children by attempting to keep them separated to the best of their ability. In short, they would lose so much instruction, and children would feel like they couldn't be with their friends. Together, we will get through this and make this as successful for our children as possible. Stay well, and thank you. Taryn McCandless.
Thank you for your comments, Taryn. We appreciate it. As always, we, as a board, take public comments and we listen to them. We take them very seriously, but we don't make any comments or responses here. We usually follow up one-on-one. Thank you so much. On to action items. Now, as we said before, this is not usually a regular meeting night. We don't usually vote on committee of the whole nights. But as we mentioned, I think a little while ago, we might be having a couple of special meetings before committee of the whole meetings to approve pressing things, given that we are dealing with rapidly changing situations. So this is just such a meeting. It's a tiny little meeting before the committee of the whole meeting that is just a discussion only meeting. So item A, one full-time elementary teacher.
So we are asking for a full-time position to be included.
Can you make the motion? I'd like to move that we approve one full-time elementary teacher position.
Second.
Second.
Thanks, Dr. Lynn.
Okay, seconded by
Stephen, I think.
Stephen.
Mhm.
And
Do you want me to keep track of this?
Nope. I got it. I have the system.
Far be it
That's a
from me.
couple times, so it's okay.
All right.
Okay, so we are, the administration is asking for additional 1.0 teacher at the elementary level, and that's to help lower our class sizes so that when we return to in-person, that we are able to 6-foot distance the kids in the class. So that's, we didn't know where things would all fall out in the end with how many kids were going to be remote and how many we'd have in person. And after we got all of those class lists and all of our jockeying around of staff, we recognized that we did indeed need to increase. It's actually increasing 2 staff members that we currently have that were working part-time last year, increase them to full-time. So it's overall an addition of 1.0 FTE.
And Jason, is this part of the analysis that you had done a couple board meetings back that showed how we could reduce class size?
Yep.
Okay. And what will the class size be reduced to?
It's a range. I believe the range is from 14 to 19.
Okay. And I remember we were talking around the 17.
Yeah, 17 is where our
Okay.
average is at the elementary.
Okay.
This is for elementary. Fifth grade is at 18. Maybe there might be one class with 19 in it to start the year, or 18. I don't know exactly where those numbers are falling out, and they keep shifting on a daily basis too. So.
Okay. Thanks.
Yeah.
Does anybody have further questions? Again, this is just so that when we go back into in-person learning, we have appropriate class sizes for the.
It will also be beneficial for remote learning, keeping the numbers low so that we have lots of opportunities for that relationship with kids, teachers. So.
Good. Okay. Roll call, please, Jason.
Sure. Ms. Ori,
Yes.
Mr. Murphy,
Yes.
Ms. Ide,
Yes.
Mr. Gray,
Yes.
Ms. Caspon-Latrette,
Yes.
Mr. Coleman,
Yes.
Mr. Guziak,
Yes.
Okay.
okay?
Motion passes. On to item B. I'd like to move that we approve the MFT Memorandum of Understanding. Millburn Federation of Teachers, that is. Second.
Second.
Can you remind us what this is?
Yes, this was a discussion that we had in the closed session last time in dealing with evaluation.
Is that we are suspending teacher evaluations for this year.
The formal evaluation process will be suspended during this pandemic, which is allowed under the current guidelines,
Emergency order.
emergency orders and such, only during a pandemic.
Does
We will still
anybody,
be- We will still be doing informal evaluations, of course, and but the formal process and data gathering, what was required previously is just really not possible.
it's cumbersome.
It's very cumbersome.
Does anybody have any questions about this? Does everybody remember?
No question, but Dr. Lind, when you speak, can you speak a little louder? You're very faint.
Yes, thanks.
All right. We'll do a roll call vote because, okay.
Mr. Murphy,
Yes.
Ms. Ide,
Yes.
Mr. Gray,
Yes.
Ms. Caspon-Latrette, Mr. Coleman,
Yes.
Mr. Guziak,
Yes.
Ms. Ori,
Yes.
All right, motion carries. On to item C. Approve I'd like to move that we approve the revised 2020-2021 school calendar as presented.
Second,
Who seconded that?
Denise. Again, this is just, obviously, we've pushed back the opening of school, so we had to revise the school calendar in order to get the requisite number of days. And we, just as a board, need to approve that. Does anybody have any questions? Is there any discussion on this?
No question. Can you zoom in a little bit, Jason?
Any particular place?
Just kind of start at the top and go on from there.
This should also be linked to the agenda for folks at home.
When is the last day of school in the summer?
May,
Ah, there it is. Sorry. Okay.
Sorry, can you scroll up one more time? There you go. Okay.
And what do we have for, well, it's probably there. What do we have for spring break? I'm sorry, there it is.
That is not
22nd.
safe.
There, okay. Maybe I can move over. There, okay, I can move my own screen. Okay.
so the only thing we've done is move back the start of school for the kids by the teachers by 1 day and the kids by 3 days.
To allow for
exchange to allow for more training up front. We start next Tuesday with teachers not in the building, but in attendance via Zoom. We start next Tuesday morning, so that's when we get our whole staff back. So we'll have 4 full days of training at the beginning of the school year to be ready for remote learning. And then we have more days scattered throughout the year that the state has allowed us to use to prepare for remote learning. So we'll get enough training in to start, and then we'll go back and look and make adjustments as we progress through the year.
Okay, you are fading away again, Jason, just so you know. Sorry.
So were you saying that ED, there's the option of adding more days in as we progress through the school year, or?
No,
Okay,
it's all
this is
on.
it, okay.
Yeah.
Okay.
Yep.
All right, then if we don't have any further questions, let's vote, please. Dr. Lynn?
Mr. Murphy,
Yes.
Miss Ide,
yes.
Mr. Gray,
Yeah.
Gaspon Lantrat,
Yes.
Mr. Coleman,
Yes.
Mr. Guziak,
Yes.
Miss Ori,
yes.
Okay, motion carries. There being no further business, I'd like to move that we adjourn.
Second?
All in favor?
Aye.
Aye.
Opposed? Okay. Then we are going, this meeting is adjourned and we will go right into the committee of the whole meeting. I'd like to call the meeting to order. We're not gonna, we'll discuss with the roll call and the pledge. And we've already done public comments. I've had no just information or discussion items presented to me. So we'll move on to our information discussion, information discussion items. The first reading of board policies. Do we have discussion around this? Anything that anyone found that they
We had already discussed 510,
Mhm.
and the other one's just nothing really material.
Okay. As always, if you think of something later that you'd like to ask, that's totally okay. But if there's nothing, no further comment right now, I'll move on to, is that it? No, we have a learning update, right? Here's the budget discussion. Oh, there it is. Sorry.
Not catching up.
It's all right. No worries. The fiscal year fiscal year 2021 budget discussion. Are we sending that to Dr. Jones? All right.
Go, Dr. Jones.
Can you pull up what I sent in the email, Jason, this afternoon?
Yes, I can. I am just a little. Oh. Pull up the business office report that was sent out this afternoon. Just a second. It's too obvious. I was looking.
Perfect.
Okay.
Hidden subtleties, yeah.
Okay, Dr. Jones, you
Oh,
want
I
to
guess I
talk
can
about
start
the
there.
components of the budget and the timeline?
So basically, because there's more than 30 days between the regular meeting in August and the regular meeting in September, we didn't have to do the budget, put it on a public display tonight. So basically, at the meeting on the 24th of August, that's when we would put the budget on public display. And then with the adoption scheduled for September 28th, in September. And then if you scroll to the third page, Jason.
Okay.
And as you're aware, things continue to change. Actually,
Dr. Johns,
yes,
is it reasonable for us to anticipate flat state funding as opposed to a decrease?
yes, according to the state, they're going to keep the funding level. So I'm not anticipating any changes this year. The following year is when the state is looking at reevaluating the EBF funding to see if they want to make any adjustments for any of the individual districts throughout the state. And that's when I have a little concern that we could see a decrease in funding just because of the fact that we've continued to have declining enrollment for this entire period. I'm hopeful that the only changes we would see at that point would be the $40,000 to $50,000 a year that we've gotten in increases, but that's yet to be determined. But at this point for FY21, I'm anticipating the funding would stay very similar to what it was this year. The other thing, well, the revenue assumption, CPI is going to increase by 2.3. The CPI increase accounts for 2.3% increase in the levy, in the cap funds, which is $242,762. Building rental income, just because we aren't really opening the building up to public groups to come in or other groups to rent our facility. I'm not anticipating that we're going to be receiving any revenue from that source. Depending on, at least for right now, not looking at any increase, any huge revenue from sports or clubs, since most of the sports are not going to be participating. There may be some, like the spelling bee and some of those things, that we may be able to figure out a way to do those remotely. Because you also want to include, once we get in school, we want to include those students as well as the students that are working remotely from home during this year. We will have an increase in the room rental monies that we get from CEDAW, and that'll be about an additional $390,000. So we're talking roughly between $600,000 and $650,000 in new funding. If you go to the expense section.
Steve, can you,
Sure.
Dr. Johns?
Yeah.
I just want to point out the CPI increase, because I've had a couple of conversations about this recently. That is money that we get from property taxes.
Correct.
That's where that comes into play. And so the total amount from all properties in the district that we receive in our capped funds, which is our operating budget, is 242,000 increase from last year to this year.
Correct.
I just wanted to point that.
Yeah.
I know you know that.
No, and I'm glad you did, because
It's easy to,
it's easy to get
Yeah.
confused.
Yeah.
And then on the expense side, COVID-related software expenses, at this point, were software and supply expenses about 82,000 so far. I will be putting a contingency line in the budget that will allow us to look at unforeseen expenses, and then we'll actually have the board transfer money from that line to the lines that we need it in. And then just listed here additional items that are in this year's budget that are new items. The social studies curriculum adoption, 47,616.25, and I believe that's a 5-year cost. The materials and things will last us for 5 years.
Right, it's
Yeah.
licenses for 5 years.
The increase in teacher and administrator salaries as a result of COVID for FY21, 136,750, and that includes the full-time teacher that we added tonight.
Can we clarify that the administrators aren't getting raises because of COVID?
No. We had one of our administrators, we added an additional 10 days to.
Correct.
So. Yeah, that's
and this is
4,500 of
this
that
is an administrator that
136,000.
usually works 10 months.
Correct.
On a 10-month contract, who has been actually working all summer. So we
Right.
have added days as opposed to, no one got a raise.
Well, they did get a raise, but not that big of a raise. Teacher negotiated salary increase, ballpark a little over 300,000. Typically for lane changes, it's around 35,000. I believe last year it ended up being closer to 40. We have the paraprofessional and MBAC negotiated salary. That's about a $67,000 increase. Custodial negotiated salary, just a little under 25,000. Transportation is about 22,000. The administration salary increase and the restructuring, all total, is actually a decrease of about 45,000, because we had one of our administrators that retired, another that went from 10 months to 12 months. So that resulted in a decrease of about 45,000. We had some other staff increases. We had some tech staff and some others, and I didn't plug a dollar amount in there just yet. Another big factor that we've got to look at this year is the health insurance increase. Our PPO plan went up about 15%. So that's about $270,000 of additional
How can it go
expense.
up 15% in 1 year?
It did. And I think I mentioned it at the time, but
Yeah,
Yeah,
we did.
we've had years of,
I know we talked about it, but it's still every
Yeah.
time it's,
and when you see that
how is
dollar
that even
amount,
legal?
when you see that dollar amount, it's,
Shocking.
we're part of a self-funded cooperative. So you know, they're always, in order to come up with the rate increase, we're looking at what our expenses were the prior year. And we actually ended up, the cooperative's budget was a deficit budget. It wasn't planned that way, but it ended up, the expenses exceeded the dollars that they took in. Now, we've been very lucky that, I think ever since Jason's been superintendent, I've been business manager, we've had no more than 2 to 3% increases a year.
That's what I'm used
So
to.
that's been 9 years worth of 2 to 3% increases.
Yeah,
So
It was
this is
4 or
just
5 years.
unfortunately,
4 or 5 years of zero.
yeah.
Yeah.
Mhm.
So we're catching
so this is just one of the bad years. We do have an additional lease payment this year for Apple with the new iPads and computers that we ordered. We're paying off the 4th payment of the 4-year lease. And then we have the 1st payment of the new lease. It's a 3-year lease. So there'll only be 2021 that will have the 2 payments. And then going forward, will just be the 83,000, but there will be that additional. And then we have the $50,000 property tax abatement. And I tried to hit the big highlights just so you had an idea of the major components. And, you know, if you do the math, you'll very quickly see that our expenses are going to exceed our additional revenues.
Yeah. So that's my question. I'm looking at the revenue assumptions, about 633,000 increase in revenue. And as I'm looking at the expense assumptions, there's about 1.2 million in impact in a negative. So what will our overall outlook be? We have some ballpark, some sense of where we'll be for next year.
Well, before we were looking at COVID, and we were looking at the projections, things didn't look quite so bad. If you look at,
So the COVID-related impact was
It's
about
about-
244,000.
so far, yeah. So that's about $250,000. So if you pull that off, then it's maybe a couple $100,000 deficit. Yeah, no matter how you look at it, it's not a positive
Yeah.
thing we look
So
at.
how is that accounted for then? Reduce the reserves then?
Yes, it will.
And we have
Yeah,
sufficient reserves to cover that.
correct. I don't know if I would say sufficient, but we do have reserves to cover it.
Right. Okay. In 2 weeks, we'll have a better sense,
Yeah.
at least of where we're at.
Yeah. Definitely.
Okay.
Is there any, the CARES Act funding has come in, is anybody talking about any further emergency COVID funding from, say, the state or the county?
I've not heard anything additional. Now, there is some state funding or some federal funding that's flowing through the CARES Act that we're gonna get. I think that was a little over 34,000. So that'll reduce some of that COVID cost. Because everything that we've done as far as PPE supplies, et cetera, would be covered, and I could submit for, for reimbursement through that. There has been discussion, and there continues to be discussion, both among, educational people as well as some of the legislators, about looking to provide some federal dollars to help schools. I mean, I think that at the federal level, some of the legislators and a lot of what's being discussed is the fact that states and local governments don't have the additional resources to cover all the expenses that we're having to do as far as getting schools open. So, hopefully there'll be federal dollars, but there's no guarantee of that.
Does anybody have any other questions for Dr. Johns at this time?
Yes, at least one. On page 3, under expense assumptions, it says include COVID-related software /supply expenses. So are those supplies related to software, or are we talking software and supplies for other things? And what would some of the supplies
For the supplies,
What would you anticipate as other supply expenses?
Okay, we have purchased additional disinfectant. We also have purchased additional hand sanitizer dispensers, hand
Okay.
sanitizer, masks, those types of things.
Okay, so it was basically two buckets. One had to do with software, and then another had to do with general supplies, I guess you would call them, not necessarily related to software or other things for remote learning.
Yeah, I plugged them both into the same bucket.
And that's fine. There's
I have a
certain,
spreadsheet where I broke it out.
Page one, yeah.
no,
page one.
that's fine. I just wanted to make sure what we were talking about. That's all. It's fine. Thank you.
Any further questions at this point?
Oh, yeah.
Page one, yeah.
Okay. We will move on to the return to learn update and discussion. Before we start, I want to thank you very much, Dr. Lind, for your leadership during this time. I think we've given people a chance to ask questions and feel heard, and I appreciate that you've taken so much time to talk to people who have questions and concerns. Thank you.
I'll talk in generalities, and then I'd like to show just a sample of a schedule of what it might look like. And forgive me if I ramble and jump right in. I didn't get a chance to prepare any specific remarks or presentation. I've been a little bit too busy now working out the details for starting the school year. So we're really, it's crunch time now, getting ready for the start of school. And our teachers start a week from tomorrow, and kids start learning the week after that. So it's going fast. So right now we're in the process of placing kids into specific homerooms and schedules. And I know Mr. Walshire sent out an invitation today with some ideas and the questions to get back to him, and he's been really putting those lists together. Those classes will stay the same for remote learning and for in-person learning. So we're not switching depending on our plan. I guess I should go back and not assume that everybody knows that we are planning on starting the year remote. That was a very tough decision that we arrived at last week after trying all summer to get in-person learning going, make it work in our district and work. As I go through this, but it came to the point where there were so many hurdles that we just couldn't get it done in a safe manner in time for us to start school. Too many questions, and there's still too many questions on the table that we need answers from either the Illinois Department of Public Health, from ISB, or the Lake County Department of Health. And we're continuing to work with them to get things answered, and we keep working through this, and we find solutions when we come to something that we have answered, but it takes time, and we just ran out of time to get that started. So what my recommendation is and was, and I sent this out last week, so forgive me for repeating, but it is to start the year remote and then work in smaller groups of students as we go. The question has been asked, why is that? What changed from when July 20th I sent out options for parents to choose whether or not they would like to be remote learning or in-person learning. And then we gathered that information and found out that 70% wanted to be in person and 30% chose to be remote. That what changed for us not to be able to start with the in-person learning. It's a long and complicated process, but I'll try and be as brief as possible and give a couple of examples. That because we want to be in-person learning, most of us do. I think all of us do. It's a matter of the level of safety that we can provide with that. And that information gathering was not meant to be a vote on whether we should or not. And all along, I hope I've been communicating that plans may change. We may not be able to meet everybody's needs. And it just became clear that we could not. So the biggest change from that point, July 20th to last week, which was the 1st of August, while we're collecting this information, was the state guidelines were saying that originally that in classrooms we could have a 3 to 6 foot barrier. That was the interpretation that was widely accepted across the state. That is still confusing because on the state website it says 3 to 6 feet. Our Lake County Health Department is saying it's a hard 6 feet, and that's what they were told by ISB, and that's their recommendation for open. That's a big deal when you can only get a certain number of desks in a classroom 6 feet apart. Each classroom has a little bit different shape, and depending on if it's a few feet wider or a few feet longer, that shape determines how many desks, whether it's 15 or 18 desks in that classroom 6 feet apart. It does make a difference. And then we also need space for the teachers to be in the class. So we've got all that worked out now. We were doing that last week. That's one thing, one hurdle, one challenge, and we're on a very tight space for that. But we had to know, we had to ask people how many wanted in person, because if the numbers work differently, we may not be able to do it if too many people want it in person, and we may be able to do it if not wanted remote. So that worked out. Figured it out. The biggest issue that I'm still working through, or that we are still working through, is the symptom. There's 2 issues related to the single symptom. You're out of school immediately. One is the disruption to the kids and the disruption to our staffing. So
Sorry, just to clarify, don't want to interrupt, but that means that a child comes and exhibits a single symptom that might be related to COVID, meaning sniffles, meaning sick to their stomach,
Yep.
cough, fever, any single one of those. Sorry.
any single one of the, I believe there's 12, 14 symptoms, which could be not related to COVID at all. So if the child exhibits any symptom, first of all, they shouldn't come to school. So we have a self-certification process that we're working to implement. So parents have to certify in the morning before the child gets on the bus that they are fever-free and have none of the symptoms, and it will be a checklist. Teachers and staff have to do the same thing. If any one of those symptoms exist, the staff member or the child has to be sent home, must. Originally, they were saying, well, the nurse could kind of work with them, and if let's say a child was sent out of a complaint of a headache and was sent to the nurse's office, and a few minutes later, the headache subsided, or a stomach ache. We have kids who are nervous in school or nervous before a test, and they get a stomach ache. Or maybe they just have to go to the bathroom and they have a stomach, little kids, they complain of a stomach ache or it's allergies or something, and they get sent to the nurse, they go use the washroom and they're fine. Well, in this case, no, they must go home. They must be seen by a physician in order to get back into school. You have to have a doctor's note and or a COVID test to get back in for any one of those symptoms that's listed. That's a big deal. That's very disruptive.
How many students do you think that would be per day on average? If it were
I will
usual?
have to ask the nurse.
10 kids per day.
10 would be pretty low at the elementary building out of 550 kids
So probably
who are still planning.
25, 50 would be sent home.
Possible.
Every day.
Possible. There'd be fewer. We only have, well, we still have 550 kids that were coming into the building. That was our original plan. So just that process became untenable. The next related piece to that is now and this was the rule, but I just didn't believe that they were actually going to say that and that there would be some flexibility. If a child is sent out of a classroom for any one of those symptoms, they must be sent home. That classroom then must be moved to another classroom. And the state guideline says that you have to wait 24 hours and then that original classroom has to be sanitized before that classroom then can move back in to maintain their space, to their original space. That's a big deal. That's going to take a lot of planning and how to do that. And if it's 10 kids a day out of 550 that get sent out of a class, there's no way we can operate. We don't have 10 extra classrooms in this building just set up for that. That's a lot. And it's a lot of moving around for kids. It's not, there has to be a continuity of learning there too. So we have to work through that. Hopefully we can get a little bit of grace with that. And I'm not talking about reducing safety because we want to make sure it's safe, but what is the value of waiting 24 hours before even disinfecting? Again, for anything. Again, it could be a headache. Those kinds of things, working that out with the Lake County Health Department is what we're really trying to work through and why we decided to tap the brakes and say, let's slow down. There's too many things up in the air. Let's get started remotely. There's a great chance we're going to be going to remote at some point anyway, and certainly individual kids will be doing remote learning because kids have headaches or stomach aches or they come and vomit off the bus because they're car sick. But now everything, almost everything is treated as COVID symptoms. So we're trying to work with Lake County Health Department to see if we can get some flexibility with nurses when our nurses know that the kid just needs to go to the bathroom, just use it, but it's okay. It's not. The symptom resolves quickly with a few minutes, but you have to know the kids, and then our nurses don't want to be put in that position either. So that's what we're working on. And then if we could do it start with a smaller group of kids. So our goal is to get kids into the building. Could we start with kindergarten or youngest students and then add grade levels as we go? So we can see how many kids do get sent. Our parents and parents aren't going to catch every symptom every morning either. There's going to be kids that come in with symptoms, but are we doing a good job of catching those symptoms? Is it screening work? And slowly build up from there. If we had 550 kids starting on day one, that I just couldn't, got to the point where I just couldn't see it happening realistically. I was asked on Saturday if after explaining that, is it pie in the sky for us still to starting with small groups of kids and work our way up? I think it can be done. It's not going to be easy. It's going to be a lot of work, but we can. I believe we can. I believe we should try as long as we have the ability. So, but I want to make sure it's safe. I want to make sure that our protocols are very tight because there's a liability issue with the school district. I want to protect the school district as much as possible. And there's liabilities that come with that. So, and I want to protect people's health. risks with, if we don't bring back kids, there's risks. If we do bring back kids, there's risks. That's always the case. And I recognize that, and there's been lots of discussion on that all summer long, every seemingly waking moment. So that was our plan to go remote, or why we plan to go remote. I don't know if the board has any further questions. I know we've talked a lot via emails and sent out a lot of information and had some discussions with the public, but not with the board.
Does anybody have questions for Dr. Lind about what he just went over right now?
Yeah, so, no, when you would send the email out, you had mentioned probably you were pushing for maybe mid-September, possibly starting to bring kids back.
The earliest would be the 8th with kindergarten.
But I mean, that new rule you were describing regarding classes moving would have to be straightened out prior.
Right.
If that was going to be a realistic goal.
Correct. So there's a small group of superintendents who are still trying to open schools. Some of the smaller school districts. We're the biggest one of that group, but we're still somewhat manageable to work through some of these issues. So we're trying to work through with the Lake County Health Department on that. So we met today and we're meeting again on Friday with some of these specific questions. So they're going back and looking at, okay, what are the risks? Is there some balance here of some factors that can be taken into consideration? Because they're trying to get the numbers down for the virus.
I mean, it seems like a pretty impossible ask. I mean, to move like that, it's almost like they're trying to push everyone in the same direction.
Yeah, I don't know. I think what happens, and I've been thinking about that a lot. I'm not a big fan of the political process in our state, but could it be that the governor is saying, okay, you guys should open schools, but then the agencies are making it so difficult? I don't think that's the case. I don't think he's purposely doing that. Of course, I've thought of that, but
Yeah.
No, being the cynic that I am in our state. But I don't really believe that he is purposely, at this point, trying to sabotage this. I think what happens, the more likely situation is that the agencies are looking, the health agencies are looking strictly at health. They're looking at all the information they have and they're saying, this is what has to happen, but they've never been in a school. So they're coming up with some of these protocols without talking through this with a superintendent. Say, what does that look like when you shut down a classroom for 24 hours, when you send a kid out for one symptom that could be anything? And there's no, you must send that child home and you must close that class and go this way without any consideration of, he said he had a headache, but
Yeah.
this young man had a headache every day last year and didn't. Or
Well, they
We
don't
know
know
it's
about
every day
kids,
during
they
math.
don't know about operations. I mean, they don't know what
Right.
kids look like every day and,
Right.
you know.
the reality,
Yeah.
there's certain realities of schools. You have to know the kids. So getting a little bit of working through that with them, I think we'll get there.
And there has to be a certain percentage of students that would quickly understand the excitement,
Yeah,
the lure of it, and start, taking advantage of it.
yeah, but then they have to be home for 10 days.
Yeah.
I think also, I mean, from the state standpoint, it's challenging having to make these rules and protocols for the the entire state of Illinois when different parts are so different from each other.
Right.
So, and the populations are so different and the infection rates are so different depending on where you live.
Well, that's true, but they could make policy in light of those facts. Right, to say 3 to 6 feet rather than 6 feet firm, or say that, you know, you can take direction from your county Department of Health on this, rather than following that. I mean, it's interesting to me that to manage this and work with the health agencies, it's a bottom-up approach rather than leadership from the top down. To say, you know, we need to bridge these discussions as a state and, you know, start to facilitate these discussions with education and, you know, department and the health department, and it's obviously not happening. So like you say, it may not be intentional.
Yeah.
It may be just negligent in recognizing that you need to start these discussions and you need to lead to start these discussions.
And to be fair, it's time. You know, just.
Yeah.
The Lake County Health Department, they're busy.
Right. Well, that's what I'm saying. This should start at the top rather than bottom up.
Well, and I mean, if I'm looking at it from the county health department's standpoint, they're probably in some way hoping that the state would be more specific. And because they don't want to come out and say something that directly contradicts something.
That's right.
I mean, I think they're in a tough spot too.
Absolutely.
So it's been
Right.
It's
very challenging.
Yeah,
Mhm.
there's definitely a lack of coordination amongst the agencies.
Well, and our understanding of the virus in the last 2 or 3 months has evolved significantly. So on top of that, our understanding of the virus, our infection rates have been up and down, and so I think it's
It's tough. It's very difficult, and it's hard to manage, and there's serious, huge consequences for these decisions that we're making. Either way, closing school is massive consequences to that. Opening school, massive consequences to that. It's going to affect different people in a different way. So we're trying to come up with how can we open school and be as safe as possible, never guaranteeing there's never zero risk.
Right.
But we don't do things by zero risk. We would never have a playground that we never let the kids come in the building. But you want to be as safe as possible. That's why we put wood chips under the swings to mitigate some of that risk. So we're trying to say, hey, what can we do to mitigate the risk for our staff and our kids as much as possible, be as safe as possible without completely shutting us down however it turns out.
Are we any closer to either the state or the county giving us specific metrics by which we then know that we will need to close, as far as infection rates, as far as?
The specific question, the specific metrics for that is coming.
Really?
That's what I was told today.
And
Who told you that?
is that through the Lake County Health Department?
Yes, or the Illinois Department of Public Health, however they're working
Okay.
together, but I was told that's coming. I was shocked actually with specificity, as in they didn't say which numbers they're gonna look at and what they are, but they said, we're gonna give you these bands of that it's safe to open, or you have to go back, or you go.
Good.
which would be
That's what
wonderful.
we need.
That's what's needed.
That's what we need, because otherwise it's.
I'll wait till, it was supposed to be here a couple weeks ago, but if that would help.
Yeah, because I mean, we shouldn't be in that situation.
No, that should be clear,
Yeah,
no question.
yeah, we need that from the health people.
But it's not just the numbers though. I want to be clear about that. It's not
Yeah.
those numbers that's keeping us from opening at this point.
Right.
But there has to be some guidance, some guiding principles, right?
Right.
Take a look at numbers and something to tell us that if we open and we hit a certain number, we have to
Then we'll
close,
close, right?
right?
Mhm.
Again, it's a matter of someone leading.
Right.
Giving guidelines.
I mean, right now, it would be whispers of a case would be the necessary
Yeah,
qualifications to close.
yeah.
Is that what we have? I mean,
Yeah, we're not even talking cases. of
yeah, no,
Actual cases of COVID.
sentence.
And we know statistically that there will be COVID in the building at some point. This, just statistically at this point with the amount of community spread that we have in our area, so we have to prepare for that. And what does that mean? And we can walk through those scenarios. That's more clear actually with one, actually it's not, I shouldn't say that. At first they said you'd shut down, if there's a case of COVID in a class, you'd shut down that class for 48 hours, 2 days while they did contact tracing. But with the testing delay, that kind of gets more and more difficult. So testing is another key component of this. We talked about setting up our own test site and partnering with some other schools in the county to set up a test site. I don't even know if it's possible, but we're working on that. That would certainly make me feel better if we can get guaranteed results back in 24 hours. That would help.
So
Because the
that,
quicker you can do that, then you can shut down, isolate. If there is a case, you can isolate it to a classroom to a great extent versus closing the whole building every time they have one case.
we saw that U of I actually recently patented their, pushed out a 30-minute up to 3-hour test. I think they're looking for partners in the state to try to test them out.
Yeah, and there's a 15-minute test available right now,
Right.
which is not very reliable.
Yeah, 5-minute positive, 13-minute negative results.
The easiest also you have to take it twice.
It
What
depends
was-
on
what
how
was
the
the-
tests
what
are
was the
being
false positive?
administered,
Yeah.
because there were some results that were published by New York University,
Yeah.
and it was immediately questioned how they were running the tests, so.
There's been troubling data behind a lot of them. Like a couple of the people that manufacture the antibody tests were getting more false positives than they'd like.
Oh, the antibody test.
That's what was interesting about the one U of I did, is it was a saliva swab instead of like up the nose.
Great.
Yeah. Like hand it to someone, they do it themselves and then seal it off and hand it back. And then like 3 hours.
That would be significant. That would be a huge move forward. Does anybody have any further questions, discussion about this very challenging topic? Okay.
I could show, just quickly go over the schedule that we have for remote learning.
Yeah, let's do that.
I'll try to be very brief and I won't do it justice at all. But most of the questions are now shifting to what does the remote learning plan look like for elementary. So Mr. Walshire has by grade levels schedules, and he sent this out to parents today. So if this is too small or you didn't get a chance, you should have it in your inbox for elementary students, not middle. Mr. Jorgensen's working on his letter too. So kids in K through 2 start out at 8 o'clock. And we staggered the starts just for tech support issues and all kinds of other reasons, but just to get them staggered helps us out a little bit, so we don't have everybody in Leonardhurst logging on at the same moment, shutting down.
I never thought of that.
Right.
That's why you have tech personnel.
So the kids will have a homeroom session that will be synchronous, and we put it in here, very small words. We put in which parts would be synchronous, which would be asynchronous. Synchronous meaning live instruction generally. And asynchronous being more like a video that kids would watch or a book that they would read on their own time. So we do an introduction lesson for 20 minutes in their homeroom, then go into an ELA block, reading, writer, grammar. So it'd be synchronous and asynchronous because for these youngsters, we're not going to keep them engaged for 2 hours on a Zoom call. So we're going to have to be rotating kids through and working with smaller groups of kids while they're working independently at home. Very tough.
But to count it as synchronous, would they still have to be, like, the kids still plugged into the same meeting, even though they're?
We have to determine, that's a good question. So is it synchronous when the teacher would have their Zoom open, and then if the student had a question, they could,
Yeah.
the teacher could say, hey, go do this worksheet, and then hold up, the student could hold up the worksheet when they're done, or ask a question as they're doing it. Or the teacher could say, hey, can you hold up your sheet? Let me see how you're doing. Would that be synchronous? Yeah, I'd say yes.
You're gonna have to, like, send out an object to cut out or something to raise when they have a question.
Well, there's a way to do that through Zoom too.
Is it hand raise?
There, you can raise your hand through Zoom.
No. Can't remember.
So those are the kinds of nuances that we'll be working through, but generally, we're going to be supporting kids during these time periods, so they should be doing work. And the teacher will definitely be teaching groups of kids. Then we move to math activities. A s'more time is when we get additional support, more of an extension of their learning time, and that's when students that need special education support or RTI support would get some of that extra dose of support. We don't have content time built into the school day for social studies science. That's purposeful. The K2, we want them to focus on the reading and math, but we're integrating those subject areas because they do topical issues, not issues, but topical subjects in order to teach the lesson. Spitting over my words, I apologize, but they already do that.
Try to
integrate it.
Try to incorporate it in the ELA thing.
Yeah.
Yep. Then they close the morning from 11:45 to 12 with another session. Kind of close out that learning time altogether as a whole class. Then we have lunchtime. And then in the afternoon, again, we have s'more. That's where we again have more opportunities for interventions, accelerated math. This is synchronous. Again, this is learning synchronous with these different groups of kids. The independent reading for those students that wouldn't be in one of these groups, that would be asynchronous.
So would the teacher be able to count, like, if it was like, say that block right there, that ends at 2:15.
Yep.
If it was segmented into 10-minute or 5-minute individual one-on-ones with like each student, would that accumulate towards the 2.5 hours, right? So like, would that all go towards it, even though it's only one student at a time?
That's what we're trying to
Okay,
determine.
so still not.
Yeah.
How, now, within these synchronous and asynchronous periods, how structured will those be? Where we're offering synchronous learning and asynchronous you know,
Right.
or we're going back and forth, how structured will that be? Will the understanding be that, I mean, are there eyes on the student to make sure they're, or is that like they're independently doing the thing? Or
It's gonna depend on the activity and the grade level, but yes.
So
Way
we're
more
looking at
structured
a-
than the spring.
Yeah, we're looking at a
Totally
totally
different.
different animal from what the emergency conditions that were this past spring.
Completely different, and it's a planned day from 8 till 3 o'clock. So
Good.
kids won't have to be online, we don't want kids online that whole time. But it's a little different if you're, it depends on what they're doing.
And again, this is the elementary school. Mr. Jorgensen is still working on the middle school schedule. So, for anybody.
It'll be interesting to kind of explore in this new setting, like throughout the you know, the year or the weeks that everyone's doing it. You gotta think about, like, I don't know, just different ways to break up the day to like keep people engaged. Like,
Right.
like maybe like finding a way to continue doing like where your parent reads to the whole class one day, or you know, different types of like maybe like a Zoom call with the fire department or something, just to kind of do some sort of something.
Some sort of something.
Yes, engagement will be key.
Also, I was gonna ask, if the child is in like in a program, I know there's a word for it, I'm drawing a blank, where they need individual instruction because of like their reading or something that they're having trouble in. Is that going to be as well as like advanced classes, or those each
Yeah.
still going to take place
During that s'more time.
during more time? That they'll meet with what is the reading group called?
RTI?
Yeah. And then
It might not be a separate RTI, it could be their teacher working with small
right.
groups of kids.
Okay.
Lots more details to come. We're still working through all of this and figuring it out. Good questions.
Does anyone have further questions about this right now? Okay. Then I'm not going to name the future agenda items because there are so very many. Just know that we'll be talking about these things sometime in the future. Superintendent report, Dr. Lynn.
I've written down a couple of things and I forgot.
You want that?
I'll give you a minute.
We're working on parent nights. We're welcoming back students and what that might look like now in this current environment. So we're going to be planning that tomorrow. Tomorrow we meet with the administrative team in the morning from 8 till we're done. A long time. And then in the afternoon, we have the steering committee for remote learning steering committee that has been meeting every week all summer, every Tuesday all summer. And then small groups have been working on specific plans for the K2 on a weekly basis. So we're meeting with them tomorrow to update and work through some of these ideas and plans and communicate that out to parents. So it's a lot going on still, and we want to make this the best experience possible in an environment that none of us want. Definitely don't want. So we're working through it, and I'm still hopeful that we are bringing kids in the building soon, as soon as possible.
Okay. Is there anything else? Lake County Superintendent, anything?
Nope, Lake County superintendents meet once a week, but We're meeting with the Lake County Health Department now.
Oh, yeah.
That is our meeting
When's your next one?
Wednesday.
That'll be interesting. Okay, then, Dr. Johns, the business office report. Would you mind going through this with us? Because I confess, because of its late arrival.
Yes, I apologize for that.
It's okay. It's understandable.
Okay.
Not complaining, just asking.
So the first part is just basically the budget calendar. All the dates highlighted that we, either the board has to do something or I physically have to go file something. So basically, tentative budget, ready for approval to put on public display next meeting, 24th. The 14th, there will be any additional discussion. 28th of September, public hearing and public adoption. Prior to September 30th, we have to post it on the district website. The total compensation package of all employees greater than $75,000. September and October, within 30 days of budget adoption, we have to file it with the county clerk, transmit it electronically to the state with the deficit reduction plan if necessary, post it on the district website and notify parents and guardians that the budget's available. The next one is CARES Act funding, and this I believe is money that's coming through FEMA. And I haven't done a whole lot with it yet, but looking at the types of items that we can purchase with that and get reimbursed for, we have an additional $34,454.76 that will also be a revenue this year. And I believe it's federal dollars, but I'll verify that before I plug it into the budget. But that'll go towards some of those COVID costs that we've already had or ones that we anticipate having as we move forward.
Are those gonna flow through the county or are they gonna?
Through the county.
Through the county, through the ROE. That's nice.
But it's good that they're adding us in because,
Yes, it is.
because we didn't get a whole lot from the original CARES Act. That was around 34,000 as well, I believe. And then just kind of giving you an idea of COVID-related expenses from both last year and this year, about 244,000 so far. Property tax collection, no additional property taxes since the last time, but I left it on here so I don't forget it next time because I'm anticipating that either just before our August meeting or just after we'll get another distribution. They'll be actually be the early taxes for the fall dollars. Construction update projects substantially complete July 24th. And then we'll have the board president and the superintendent sign the paperwork for occupancy, which even though most of it's outside, technically we have to go through that process for occupancy. There will be a change order in the next meeting. The posts and rail as originally installed don't meet the current code, and because it's a 2-story deck, there was a concern that basically were just held by nails and screws, that it just didn't really seem very substantial. So in order to do it up to code and then replace the stairway, that was an additional $3,675. And the architect recommended that we do that, and it was a good price. And she even thought that it was a good price before I found out that it included the stairway. So I was a little shocked when I walked over there and we had new stairs as well. This is a busy month for reports. The employee information system report is complete and is out there on ISB's site. The annual transportation reimbursement claim is also due on the 14th, as well as the site-based expenditure report. Then this year with the health insurance, we're actually changing the plan year from June 1st through May 31st to September 1st through August 31st. So even though we had open enrollment for staff members in the spring, we're going to have a soft open enrollment. So if anybody wants to make any additional changes, they can do those and they'll be effective September 1st. The flexible spending plan, we did an open enrollment earlier this summer, but for new staff or anybody who missed it, and I do have a few that missed it simply because they were remote learning and there was so much going on that, you know, I got a few emails a couple weeks after the open enrollment was closed saying, you know, I can't get on to do it. No, you can't because it's closed. So we'll get that taken care of. And then we have the adoption of the budget. And then the other thing on September 28th, we'll present the teacher salary and benefits report to the board because it has to be presented to the board prior to October 1st. No action is necessary, but it has to be on the agenda and presented. And there will be not that I expect you to remember, but we do have a few staff that, for instance, like the speech language therapists. According to the state, they're non-teaching. So technically they won't be on that list. So, you know, we will get a few questions once we post that from people. And I've also gotten questions from the board in the past too. Well, why isn't, you know, XYZ on the list? We went through the budget assumptions, COVID-related changes, a couple things that we are doing. We did get, and that was part of that cost of equipment and supplies. One of the things that there's a concern about is with the hand dryers, and if kids aren't cleaning their hands properly and then they're drying them and it's blowing the air around with everyone there. So we do have the paper towel dispensers we ordered, and we ordered new trash cans as well as paper towels so that they can pull out the paper towels without touching anything. And then the water fountains also need to be, I believe, any of them that we can turn off, we're going to turn off. Otherwise, we'll just, you know, put a garbage bag or something over them indicating they're not to be used. If I remember correctly, we only have 2 bottle filling stations, 1 at each building. And I am having our head of maintenance get some pricing if we were. The problem is that most of the water fountains in our 2 buildings, they don't make an adapter so you can add a water filling station to them. So I'm having them get a price of what it would cost either to add a water filling station in place of the fountain or get a replacement fountain with a water filling station. We may find that that's going to be cost prohibitive, but I at least want to get that cost so we can look at if that's something we want to do. Because that would actually allow students to access those close to their classroom without touching anything because they just push their bottle up to it. That's about all I have right now.
Okay, does anybody have questions for Dr. Johns? Thanks for going through that. No, okay. And on to board reports. Anybody have a board report? If no one has anything, I do have something. The Lake Division of the IASB, I'm on that board that puts those programs together for us. She sent out something saying, Laura, our Martinez, our person, our liaison. I was going to ask you guys for some feedback. So we were talking about having a legal presentation about some concerns that, since we've talked, and may look different. So do we want to focus, the question is, do we want to focus it on the district's liability when it comes to health and safety, such as enforcing mask wearing, or what happens when a student presents with symptoms at school. This is for the fall. Or perhaps focus on special education and what that looks like when students are learning remotely, or another topic. Does anybody have, like, if you have insight or input or things that you want to know about, then I'll take that into account when I give her our feedback.
I think of those three, the second one regarding what to do if a child shows symptoms. Jason's got that covered, I think, right? You got to figure out the pulse.
I will.
Working with the Lake County Health
Yeah.
Department, right? That could be one potentially that we wouldn't need to cover.
By fall, yeah.
But
Are you saying to pick one that we'd like to?
Yeah, so this will be on October 14th, if that helps, at 6:30. It'll be remote, obviously. It's going to be, most likely be a webinar. But, so one of them, so it's like special education. Then there's like a general liability thing. And then health and safety. So
I would say the liability.
I'm real interested in the liability too. And what's being done.
Yeah, and interesting to see what happens if some schools do implement in-person learning by October 1st. See something.
One would
That'd be
hope.
interesting.
Yeah. So general liability, is
Yeah, I
that,
would think so.
okay, I'll give her that feedback, thanks. Okay. Anybody have anything else?
Somebody just unmuted themselves.
What?
No, I thought I agree with them.
Yeah,
Alright.
it was me. I was saying I agree with general liability as well.
Okay,
Mm.
thank you. I'll give her that feedback. Good. All right, then there being no further business, I'd like to move that we adjourn.
Second.
We can do it all in favor.
Aye.
All in favor?
Aye.
Aye.
Opposed? The meeting is adjourned. Thank you, everyone.
Good night, guys.
Good night.
All right.